Moodivator allows users to set goals, track moods, manage medications, and log progress. Based on current technologies and services offered, such as applications like Doctor on Demand, where users can communicate directly with medical professionals, it is not too far-fetched to imagine a future use case where users can communicate with an artificial intelligent therapist. The primary actor in this use case is the mental health patient or user of the application. The main success scenario would be the user activates the speak to therapist feature, engages in effective dialogue with the therapist, and the AI will understand the user's illness and help the user overcome fears and insecurities, cope with stress, identify triggers, and provide other forms of care. The following clip is a demo of this future use case.
Hello, Robert.
Hello.
Since the last time we spoke, have your symptoms of depression lessened?
Not really. The last week has been extremely overwhelming and I don't see the light at the end of the tunnel.
Given your schedule and stress level, it is important you lighten your load. Sometimes people in your situation turn to hobbies or at least have an outlet to let out some steam.
Yeah, I guess you're right. I should pick up the guitar again.
Also, don't forget the breathing techniques we discussed last week.
That's right, of course. Thanks, you've been very helpful.
Don't mention it. See you next week.
Moodivator might have done a good job to improve mental health, but just by setting goals and sending medical data is still not enough. With advanced technologies, Moodivator could help people more realistically in an easy access way. But how? Let's take a look at these two technologies. First one is MultiSense technology created by the University of Southern California Institute for Creative Technologies to give computer ability to identify indicators of psychological distress, such as depression, anxiety, and PTSD. MultiSense drives a virtual reality doctor program called SimSensei, which is aimed to treat people with depression and veterans with the PTSD. It contains a computer program called LA, which uses webcam and microphone to observe the patients and give SimSensei feedback on when to ask certain questions, when to not, and how to analyze the emotion cue. Another technology is from team of researchers from Harvard and the University of Vermont. They recently developed a machine learning program that can pick up on the early signs of depressions before human and even human who are generally practitioners can, just by using Instagram, and that correctly identify which Instagram users were clinically depressed with 70% accuracy. 70% is actually not a lot, but this technology does expand the potentials of tracking people's depression level in various ways, and combining with MultiSense, in the future, all of us could have an artificial intelligent therapist to provide advices, cheer you up, and it might just become one of your best friends.
With AI, people that were previously unable to see a doctor would now be able to receive help. There are very specific cases in which AI doctors would be exceptionally beneficial to patients with issues talking to real doctors. First off, there are many times where a patient has something they would like to discuss with a doctor, but sometimes they feel uncomfortable, or they would think they will be judged, causing them to neglect to disclose this information, which could lead to further problems down the road. As well, there is an actual phobia known as latrophobia, which describes the fear of doctors. Those that suffer from this phobia are afraid of doctors, their offices, and all things that go with doctor visits. Many people die each year from lack of medical treatment just due to the fact that they refuse to seek help out of fear. AI doctors would allow those who are afraid to have an opportunity to do so without being judged, as AI are not like humans in that regard, and also this would give people who have a fear of doctors an alternative to still be able to seek help. Overall, these are both benefits for society, creating a safe environment for all to receive medical help, something that is truly needed today. On the other hand, one major issue with a system such as this is reliability of data security. Simply put, when someone goes to a normal doctor, they usually know that their data is safe as they are communicating directly with their doctor, who is then storing their data in their system. However, with AI doctors and communication through an app or a third-party service, this could lead to some potential problems with data security. This can and will cause some fear to arise about who or what is accessing data of potential users of these systems, and this will have to be addressed by software developers if they ever hope to make this become widespread. People today are very uncomfortable with the idea of other people seeing their data without their permission, and with medical information, this is even more true as the information is usually more sensitive. I foresee these issues being addressed in order to alleviate fear, but until that time comes, it would be very hard to get many people to use these services.
Moodivator and other mental health AI apps can be used by anyone who has access to a mobile device, but it is a much more appealing option for those who may not be able to access or afford the mental health care they need. This not only includes people who live in rural areas that have to travel fairly far for mental health care, but also people who are considered low income. A therapy session can range from $50 to $300, which is a hefty price for those who may not have much of a disposable income, whereas an AI therapist would cost much less or even be free. Recent statistics show that about 40% of severely mentally ill patients, such as patients with schizophrenia, receive no help, with the percentage being much higher in developing countries. So one can only imagine the percentage is even higher for those who face mental health conditions that are not labeled as severe, such as situational or atypical depression, anxiety, or even OCD. Finally, society as a whole benefits because, as mentioned before, many people who require mental health care don't always get it, so as a result, untreated mental illnesses cost the U.S. at least $444 billion per year in medical care. So if mental health apps can bring that percentage down, then a chunk of that $444 billion could be spent on something else.